Hello, I'm Greg Tully. I'm with Liliana Pacheco, and we're going to discuss a new collaborative approach between a city government and several grassroots charities to carry out effective dog population management. So this is taking place in Kathmandu, which is the capital city of Nepal. It's home to tens of thousands of roaming dogs. They're everywhere. They're really embedded in the community. There's a widespread fear of rabies, which has caused a lot of mistrust of dogs. And as a result of that, the government has been poisoning dogs. Well, it was poisoning dogs for decades. They put out meat with strychnine, which caused horrific deaths. People's outdoor pet dogs were sometimes poisoned as well. This killed roughly half of the dogs in the city every year. And by the next year, the dog population returned to what it was before the poisoning. So even though it was obvious that this wasn't solving the dog population problem, the government continued it. It was cruel and dangerous and ineffective.
So to stop this brutal cruelty in 2004, a British woman named Jan Salter founded the Kathmandu Animal Treatment Center, Nepal, Nepal, and it was the first NGO to do a proper dog population management in this country. Cat made the first agreement with the municipality so that they wouldn't poison dogs in the areas where Cat worked, and this proved to be a success.
So at that time, the urban area of the Kathmandu Valley, where almost all of the dogs were, was essentially inside the ring road, which is the yellow, sort of somewhat circular road. Um, And the dog population surveys inside the ring road showed that as a result of Cat Center Nepal's work, the dog population decreased from 31,000 dogs to 22,500. And throughout that whole area, 40% of the females were sterilized. Surveys also showed that the dogs in the area where the Cat Center was working were healthier than in other areas, and people had better opinions of them. A rebellion by the Maoist army caused a lot of people to move from rural areas of Nepal to the Kathmandu Valley because it was the safest place in the country. It was the only place that the government was really defending. Also, because of increasing globalization, more young Nepalis want to get quality educations now and get visas to live in other countries, and Kathmandu is by far the best place in the country to do this. So the human population in the Kathmandu Valley has been increasing rapidly, and as has been found in many other cities, the dog population tracks the human population, and so the number of dogs has also been increasing fast. Now the urban area of Kathmandu has expanded far outside of the ring road. Although 20 years ago, dog population management could really focus on the area inside the ring road and almost ignore outside of the ring road, which was basically farmland and villages. But now I'm sure that in the Kathmandu Valley there are far more dogs outside of the ring road than inside it. Now, other organizations as well as the Cat Center have started sterilization programs, which is terrific. But because there are now far more people and more dogs in the area, these efforts were no longer enough to reduce the dog population. Almost 10 years ago, a large-scale collaboration between an international NGO and the Kathmandu municipal government was launched with the goal of managing the dog population in the city of Kathmandu, which is most of the area inside the ring road. It seemed promising, but it was discontinued after a few years and it didn't make a long-term impact on the dog population. So there was a challenge. The municipality alone doesn't have the expertise to plan and conduct an effective dog population management program. International NGOs can make important contributions with funding and expertise, but not being based in Nepal, they don't necessarily have the long-term commitment to Kathmandu that's necessary to work for decades to sustainably reduce the dog population. Nepali organizations do have this long-term commitment, but they don't have enough resources to cover the entire urban area of the Kathmandu Valley. Now, one positive change that's happened in Kathmandu is that there's a rapidly growing upper and middle class, which has provided the municipality with a lot more money than it had in the past.
So recently, the municipality of Kathmandu decided to use a new approach to manage the roaming dog population sustainably, and humanely. Instead of depending on the government staff or one Nepali NGO or a single large foreign based NGOs, they decided to divide the municipality into 9 working areas and assign 1 or 2 to these areas to several local NGOs and some vet clinics. That these clinics and NGOs had previous experience in this area. The size of the area depends partly on the capacity of each organization or clinic to conduct these sterilizations. The municipality signed an agreement with each organization and clinic, which says that partners collect dogs in their working area, they sterilize them, vaccinate them, and then return them safely to their homes, the home area, as soon as it is allowed. Then they submit a report to the government about what they did, and the government pays them for their sterilization.
There have been some challenges with this collaborative approach, especially in the early days. One of the first challenges was that initially the government chose partners based on a tender process, similar to a project to build a road or a building. And they signed some contracts with the lowest bidders. The organizations or clinics that said they could sterilize dogs for the lowest cost, rather than working with organizations that have reputations for conducting safe, humane surgery. This resulted in post-operative complications in some areas, and dogs were returned to the streets who actually needed more medical care and shouldn't have been returned yet. But after several discussions and meetings about this, the municipality is now much more careful about choosing its partners, and it doesn't use the usual government tender process of just choosing the lowest bidder.
Since Greg and I moved to Kathmandu at the beginning of the year, we've been supporting the cat center Nepal. We went with some cat staff to meet with the head of the Kathmandu Veterinary Department and then discuss the program that we have been talking about. This was possible because CAT has spent more than 20 years developing this collaborative relationship with the government officials, and CAT has been a useful resource for them. That's what they allowed all this. Most NGOs in Kathmandu, unfortunately, aren't able to do that and contact the head of the veterinary department and meet with them because they don't have a good or a relationship with them.
So when we met with the head of the veterinary department, we asked him how they evaluate the impact of this program and how they measure its success. And he said they count the number of dogs that they sterilize in each ward. None of the participating organizations or clinics were expected to conduct any sort of dog population surveys. Now, clearly the goal of this program is not to do as much surgery as possible, so the number of animals you put through surgery is not a good indicator of success. But through a series of meetings and conversations, we convinced him of the importance of using dog population surveys. The surveys make it possible to demonstrate the impact of the program on the size and the health of the roaming dog population in a quantitative way. And also, surveys enable you to assess people's attitudes towards roaming dogs.
So for that, we organized meetings with the municipalities and the participating organizations and clinics about this. When doing the stray dog population management, it is important that the methods for the data collection are consistent and possible to reduce error. If you see differences in the number of dogs or the percentage of dogs sterilized, you want to know and make sure that it is because of the sterilization program without wondering if it is because some of the people did the surveys more carefully than others or just did it in a different way or a different time of the day, etc. So standardization is very, very important. To combine the data from across the city with a little variation as possible is a must. We've been providing organizations with training on how to conduct the dog population management and surveys consistently. This includes the theory of the surveys and and specific methods like what time of the day we go out to count the dogs, how fast do we go on a motorcycle or if we walk, whether to consider dog roaming as per se or a dog that is an own dog, how to recognize skin condition, how to assess the body condition scores and signs of ownership, for example. We train the partner organizations to use the Talia app, which makes it very, very easy to collect the data and upload it, even for people who cannot read Latin alphabet or else. It's based on icons and it's very, very user friendly. We're training the Kathmandu's IT department to be the administrators of Talia and the Wise Monkey platform so that eventually the Nepali people can continue all the aspects of data collection and analysis without being dependent on us.
I have a feeling that some of the organizations have been collecting the dogs that are easiest to catch throughout their working areas rather than following the best practice of focusing on catching as many dogs as possible in one small area and then moving to an adjacent neighborhood. So when we see the results of these first surveys, I have a feeling we'll find that in some parts of Kathmandu around, I don't know, 40, 50, 60% of the dogs have been sterilized, and the remaining dogs are breeding so much that there hasn't been any reduction in the dog population yet. If this is the case, we'll advise the municipality to tell all the partner organizations to focus on one area at a time and catch every dog in that area that they can, and only move to another area if a survey shows they've sterilized at least 80% of the dogs. So, what's the current status of this program? The collaboration between the Kathmandu Municipality and 9 local NGOs and clinics, it started too recently to produce measurable results yet. Also, unfortunately, it's been temporarily paused because there's been distemper in the city, and so there's a decision by the municipality not to collect dogs from the streets, move them to shelters and clinics for surgery, and then put them back on the street again because moving dogs around like this can spread distemper. So the first population surveys haven't been conducted yet. However, we're looking forward to this program restarting soon and the partners conducting surveys every 3 months. Liliana and I will stay involved and we'll provide advice based on data about making the program as effective as possible. We'll also provide ongoing training and guidance about how to consistently conduct the street dog surveys and how to analyze the data. Furthermore, we'd like to see the program become more comprehensive dog population management with the addition of community engagement and human behavior change to complement the sterilizations.
So in conclusion, the 9 organizations that have been chosen have experience with sterilizations. They are permanently based in the Kathmandu Valley, and they focus on the long-term health of the Kathmandu's dog population. The program isn't subjected to the priorities of foreign NGOs, which can change over time. Another advantage is that using a local NGO already know the community leaders, the wards, and the government officials. Also, none of the organizations are indispensable. If one of them can no longer participate or isn't conducting safe surgery, the municipality can easily assign their work to any other organization that is already participating in the program. And also the program is funded and led by the government, which increases the sustainability of it.
So far, this new collaborative method has a lot of potential to produce a sustained reduction in the roaming dog population. And soon we'll have consistent data collection that will provide publishable evidence about how effective it is. And so we'd encourage other organizations and government agencies that are working on dog population management in other cities to consider a similar approach of collaboration with multiple stakeholders. Well, thank you very much, and we welcome any questions that you might have.
Yes, thank you very much.